Yes.
Welcome to the Community-Based Organization Onboarding Training. In this presentation, you'll learn the basics about the grant your organization has received from the Oregon Health Authority. Hello, my name is Dolly England, and I'm the manager of the Community Engagement Team. This is a recording for our general onboarding training for the community-based organizations who have received funding from the Oregon Health Authority's 2020 COVID-19 CARES Act Fund. Here's what we will talk about in this training: Oregon Health Authority's acknowledgement to community engagement, to the community engagement team overview, and a basic overview of the funding structure and requirements. We acknowledge there are institutional, systemic, and structural barriers that perpetuate inequity that have silenced the voices of community over time. We are committed to partnerships, co-creation, and co-ownership of solutions with communities disproportionately affected by health issues so that groups can actively participate in planning, implementing, and evaluating efforts to address the COVID-19 response and other health issues. We recognize community-engaged health improvement is a long-term and dynamic process. We are striving to engage with communities through deliberate, structured, emerging, and best practice processes. We are striving to make engagement with public health effective for communities, especially those communities that experience institutional, systemic, and structural barriers. Here's what the commitment looks like right now. It's an ongoing process of co-creation and developing solutions. We acknowledge that COVID-19 has impacted the health of Oregonians and has highlighted health disparities that existed before COVID-19. These are entrenched and challenging problems that none of us can address alone. We've reached out and listened to community leaders for the entire COVID-19 response, and we hear you loud and clear. You are the experts of your community. Oregon has chosen to use CARES Act funding to support community efforts to address COVID-19 across the state. So here's the thing. Oregonians look out for each other. The funding through these grants is intended to serve some of us who have faced the most challenges during this time. This includes Black, Indigenous, and people of color, people with disabilities, families, people who are houseless, individuals with substance use disorder, immigrant and refugee communities, faith communities, undocumented communities, farm workers, people experiencing mental health issues, older adults, and the LGBTQI+ communities. Here's some shared language that we'll be using throughout this conversation and throughout the work that we'll be doing together. CBO, community-based organization. LPHA, Local Public Health Authority. OHA, Oregon Health Authority. PHD, Public Health Division. CEC, Community Engagement Coordinator. Contact Tracing. Quarantine or Isolation. Wraparound Support Services. I'll be mentioning our website several times throughout this training. I recommend that you check out the resources, examples, and information available online. This is updated constantly. Here's what the top of the page looks like. There's a section for frequently asked questions, and many of our documents are available in Spanish. Also on a website, a searchable database, which lists all of the organizations we are funding, along with the types of services they are providing. I encourage you to check it out sometime. Our team is known as the Community Engagement Team. We are a part of the Oregon Health Authority. As you may hear when talking with us, our team is new, but we may have some trusted and familiar faces. Our team has a goal of helping to connect community-based organizations like yours with local public health entities and each other to address challenges Oregonians face related to COVID-19. Here's a little bit of a visual structure if that's your thing. In every presentation, I want to make it known that these smiling faces, they're the community members, community-based organizations, you. You are the core function of our team. We collaborate with other organizations within the government and outside the government that make up the safety net, along with local public health agencies. Here's our team. We are in the process of hiring 2 additional community engagement coordinators. Here's a map of our community engagement coordinators by region. This map is also located on our website. So what does the community engagement team do? We provide ongoing support through conversations and technical assistance. We support relationship building and workflows between CBOs and local public health authorities. And we elevate, reflect, and share your feedback. We are charged with developing and engaging a statewide network of community-based organizations, CBOs, or you, who will partner with local public health authorities, LPHAs, to implement outreach and engagement, contact tracing, and wraparound support services to individuals impacted by COVID-19. All of us will work together to support our main focus, our community members. We will be using funds and resources we develop, like talking points, videos, and flyers, to give organizations like yours some of the resources and tools to conduct community outreach and engagement around preventative messages related to COVID-19. We will be using our funds and resources. So we will also train community-based organizations to provide contact tracing to Oregonians who may have been exposed to COVID-19. Here's a visual of some of that. By working with you, we hope to receive real-time feedback from your perspective about what's happening in your community related to COVID-19. We will share your feedback, ideas, and data to the COVID-19 response teams. By doing this, we hope to create opportunities for regional systemic engagement and systems change with the Public Health Division. Simply put, our team elevates your voices, insights, and experiences. We're a new team, so we thank you in advance for giving us grace while we figure out these systems and processes. Our goals are to support you and your community in any way we can. If you have questions, concerns, frustrations, reach out and let us know. You may have already heard of one of our sister programs, the CPOP team, or Community Partner Outreach Program. They serve by engaging communities across Oregon to advance an equitable, responsive health system. They develop a statewide network of medical providers, community partner organizations, state agencies, and CCOs to reduce barriers for OHP application and enrollment for Oregon's most vulnerable populations. They create opportunities for regional systemic and engagement with OHP. We will work closely with the CPOP program doing this very important work. Let's start talking about grant information and requirements. Here are the 3 focus areas of funding, or sometimes we call this the 3 buckets of funding. They are contact tracing, outreach and engagement, wraparound support services. You'll be going through trainings focusing on the different areas your organization was funded for. These will be live trainings. More information will come soon. The thing we really want you to know is that this work is interconnected. You really can't do outreach and education without also connecting folks to other support services and potentially helping them get tested and perhaps a need for contact tracing. And you can't do contact tracing without providing information, outreach and education, and perhaps some wraparound services. We want folks to know that these services work seamlessly together. And so all of your work is important, and we need all of these 3 bodies of work to happen in order to serve Oregonians. Funding. Your organization received funding for one of the 3 areas of service. Some of your organizations will work on all of these areas, and some just have funding for 1 or 2 service areas. Here's an example of some of the CBOs we have funded. We are super proud to have funded Oregon community-based organizations from so many different types of communities. To view the full list, please visit our website. Okay, let's talk about funding for the first 3 months. We're here to help you figure out how to use these funds to meet your goals. So the main thing I want you to know is we want to see you spend that money. Although funds can be rolled into your second quarter, you cannot spend them after 12/30/20, and you will need to return any unspent funds to OHA by 1/31/21. So we encourage you to hire staff, use all of your $5,265 for startup costs. Start doing that work, whatever that may look like for your organization. Do you need internet, computers, telephones? Make sure to track your invoices and expenditures. Also note that you can invoice us back to 7/1/2020. We are scheduling several expenditure and reimbursement webinars, so please stay tuned. More information will be coming in the upcoming weeks. We are providing a sample copy of your quarterly report form. Based on community request, we are sharing this form in a monthly format to help track the work you are doing. This and other resources and tools have been added to our website. Your organization has probably already received the first amount of funding. We wanted to share some additional information. The amount of money your organization gets may change, and it might increase or decrease. For many organizations, the funding will remain the level that it is. That is to say, it will stay the same. To be transparent, here's how we will make decisions about changes in the funding for the time period of September to December. We will look at, has your organization spent the money for your grant so far? How many people have you served? Are there any impacts for us to consider on your work? Maybe the first part of your grant happened during a slow time, or there weren't many cases in your region, and now there is more. Are you increasing or decreasing your scope of work? For example, are you adding a component like doing contract tracing when you previously were only doing wraparound services? Have you decided to stop providing one type of service? We will also review data to better understand where the current COVID-19 outbreaks are happening and provide additional funding to CBOs in those areas to assist in the response. After December, we will have $6.7 million for contact tracing for 24 months. We need to figure out how we will adjust the time frame of the grant award. CARES Act funds were a part of the 2020 federal appropriation for COVID-19 relief. They expire on December 30th of this year. It would take an act of Congress to add more funds or change that expiration date. Note that funds are likely subject to a federal audit. We need to ensure funds are used and documented appropriately. What tools do you need to support your management of a federal grant? How can we help you? Here's what's happening in our timeline for August 2020. It's going to be a busy month. Each staff member or volunteer will go through onboarding training. This includes this training and the specific area you are funded to work in. So if you're only funded to do outreach and engagement, you'll only need to attend the outreach and engagement live online training. Your first quarter's budget is due on August 31st, 2020, along with the proposed budget for quarter 2 and the expenditure report for the first quarter. We have provided a budget template on our website. If it's helpful, feel free to use it, or you can create your own organization's template if that's easier. We will also be collecting the progress report for July and August. If this sounds like a lot, no worries. Chat with your community engagement coordinator. They will be reaching out to set up a monthly conversation to see how our team can best support you meeting these goals and supporting community. As part of the community building efforts, your community engagement coordinator will be hosting monthly regional meetings. This will be a great time and place to connect with others in your area who are doing similar work. Your CEC will reach out with more information about these meetings soon. In September, you'll have monthly regional meetings, a monthly meeting with your CEC, and we will send out notifications of second quarter awards. That's October 1st through December 30th. In October, CBOs will need to invoice OHA for their full quarter 2 award, just like they're doing for quarter 1. We anticipate most CBOs will receive the same funding for quarter 2 unless they're doing more work, additional scope of work equals more funds, or they are not spending or doing all of the work they originally proposed, less funds. This may be beyond their control. For example, if they are receiving funds for contact tracing, but are not needed for a lot of contact tracings, or the same for social services and wraparound supports. November, monthly regional meetings, monthly meeting with your community engagement coordinator. December, we will amend contracts for new funding and contract tracing scope of work effective 12/31/20. We hope to identify additional funds, and we are working very hard to do that so that we can continue this work after December 2020. Beyond December, we'll have our quarterly financial report due January 31st, 2021, as well as a quarterly progress report due January 31st, 2021. We recognize this is a step that may not have been clearly communicated when we developed our scope of work. We are finding that sometimes people need assistance related to contact tracing and wraparound support services, even on the weekends. We will ask all CBOs providing wraparound support services to identify an on-call staff for the remainder of this year. We will send the link electronically to those CBOs as further onboarding takes place. Additionally, the community engagement team will also have staff on call over the weekends to assist should needs arise. LPHAs also have 24/7 on-call staff to support your community needs. Another reminder that as you are doing this work, we would like you to think about stories of individuals, families, or situations that happen during your work, good or bad. This storytelling is a way to collect data called qualitative data. It's a great way for us to share with OHA leadership about this work, the successes, challenges, and show the need for continued funding for this work. Every report will come with an area for you to tell us whatever it is you want us to know. This is a screenshot of our reporting template, so you will have a heads up of what it looks like. Media and publicity. We want you to get all of the press you can get, but we'd like for you to make sure that you connect with OHA prior to doing so. We want you, again, to share your work with your community. Always please use OHA guidance and resources as the basis of the health-related information you are sharing. And any info on use of the OHA logo will be included in the outreach and community engagement onboarding training. If you do get contacted by the press, please notify your community engagement coordinator, and we will work with you to have the most amazing interview ever. You may be wondering when to call who. So basically, for community engagement coordinators, anything related to this scope of work or COVID-19. When would you call ROCKS or the CPOP team? When you need help accessing health insurance related resources. We're including links to the CPOP website, which also include a list of community partners who can provide direct assistance to individuals needing to enroll on health insurance. We encourage you to check out their website and to find a community partner in your region. Weekend OHA staff. Something will happen eventually where you will need assistance on the weekend. We will have OHA on-call staff available over the weekend to assist with situations where there is an immediate need related to assisting an individual or family in accessing isolation or quarantine. So let's talk about the LPHA versus the community engagement coordinator, or local public health and community engagement coordinators. Each local public health authority, or LPHA, has an assigned OHA public health systems consultant to support their work. Public health systems consultants will work side by side with CECs to help with working processes between CBOs and LPHAs. CECs and public health systems consultants are a part of the same team here at OHA. Here are some recommended resources and websites that are available in the resource guide on our website as training material for this training. There are many other resources embedded on each one of the sites and on the resource document. We encourage you to share this resource guide with your team. All right, how to connect with the community engagement team. Not sure who your community engagement coordinator is? Check out our website. And for any general questions, comments, or concerns, feel free to email us at our general inbox, community.covid19@dhsoha.state.or.us. Depending on your funding group, you'll be taking another onboarding training. These will be offered live and will be announced on our website and by your community engagement coordinator. We highly recommend that all staff and volunteers involved in this work take these trainings to understand more about their role and the processes. We thank you so much for your time and energy, and we can't wait to work with you. Thank you and have a wonderful day.